Hello, my name is Jennifer Wheeler. Thank you so much for taking the time to listen to my community assessment on Windham, Connecticut. Windham, Connecticut is a gorgeous town that sits about 28 miles east of Hartford. It used to be a mill town because there is a gorgeous river that runs through it. Most of that industry has since left, but a lot of those buildings have been interestingly repurposed, as you can see from this picture, into art spaces, apartment buildings, and retail shops. The town had a very appropriate motto, one community, endless opportunities, which added to how much it fit for this project for GPH 732. Even though that picture I showed you of the mill community appeared to be more urban, the majority of the square mileage of this town is, or I would say not even suburban, but rural. Lots of farms, rolling hills, gorgeous, gorgeous in the fall. The zoning map I put up, not for detailed assessment because it is very busy and the legend is barely readable on these slides. I wanted to put it up there so that you could look at it from a larger sit-back view. So the majority of this is white, and that white portion shows rural and suburban farmlands and neighborhoods. And then as you start getting to the more densely puzzled area, you start getting into the industry, education, faith-based communities, hospital-based areas, as well as public parks and public areas. And it's actually where the more densely populated areas of the community are. If you look towards the most western point where that wedge is, that is where you're going to find Willimantic, which is the urban community within the town of Windham. And sometimes you'll hear me referring to both of them, but Willimantic is a town within Windham. So here is one of the side streets of Willimantic, and this is very common residential neighborhood for that area. The town itself, that whole zoning map that I showed you before, is 28 square miles and houses a little under 2,500 residents. The majority of the residents do reside in that wedge to the west that is referred to as Willimantic. And the makeup is about 50% white, 41.5% Hispanic, 6.3% Black. And of that population, about 2,700 is foreign born. And what's fascinating is while the population as a whole is decreasing, not because of morbidity and mortality, but because of just good old-fashioned moving out, there are increases in the population. The Hispanic population has seen an increase of over 14% in the last 5 years. And of the households in the whole community, and not just Willimantic, but Windham as a whole, 40% don't use English as the primary language at home. And that doesn't mean that they don't speak English, it just means that's not the primary language. Now, the socioeconomic diversity and industry that is available in this community, unfortunately, is pretty poor. So we've got a poverty rate that is below the state average. We've got median incomes per household and per capita that are well below average. And the employment rate is very high. And I use the 30% because that's what the town center of Willimantic is. And that's where it's most densely populated. The largest employer is healthcare, and we'll talk about why. There's a large hospital in the community, as well as a large primary and preventative care center. But there is retail as well as education opportunities for employment that are huge. Retail is the biggest GDP, though. Retail is where there is the biggest revenue base from taxes. This is a picture from Main Street, Willimantic, and you can see it's dotted with small businesses. You go a little bit further down that road and onto the highway, and you'll find yourself in an area that's got chain stores like Walmart and Michael's and Home Depot. So all of that retail is available in this area. The educational attainment levels are a little bit below and at average. So you've got a attainment of high school graduation about 80%, excuse me. Whereas it falls low is in higher education with only about 20% of the population having a degree at a bachelor's or above. So once I had a good idea of the demographics of this area, I wanted to look at the health profile, and I did that by meeting with one of the healthcare leaders at Windham Hospital, which is a not-for-profit hospital owned by Hartford Healthcare. Great hospital, tons of services, everything from emergency medicine to operating to preventative care, OB, you name it, and then great telemedicine services that is paired with Hartford Healthcare. But I wanted to talk to Mr. Pavlichenko, who, like I said, is the EMS coordinator there, and talk about his opinion on where he thought the health disparities and the health of the community was. And his big comment, again, it was emergency driven, was that the community seems to use the emergency room like primary care, and unfortunately don't use primary care as primary care, and we see patients very sick in the emergency department too, when the situation could have been possibly addressed by a primary care physician. And preventative medicine doesn't seem to be a priority in the community. And I didn't know if that was resource driven or patient driven, or community member driven. I used the term patient, I apologize. So I went back into the qualitative and quantitative data that I had collected, and the quantitative data showed that it is still resource driven, while there's still probably an educational portion of it. When you look at a ratio of physician to population, and when you have a single physician for 2,200 people, that's a number that is not only a national low, it's the state. So the state has about usually anywhere between 15 and 1,800, but Windham as a community has one of the highest ratios. And when you have a community that's really highly dependent and has a lot of health disparities that require the care of these physicians, you're going to run into issues. So when Paul and I finished talking, I asked him what he thought, were the leading causes of death. And, the opioid crisis was his number one. Again, completely anecdotal. And, I thought that would be definitely an interesting avenue to research. But I wanted to look more in depth of what the premature death rates and what type of health issues this community was facing. And I was shocked to find that despite modern medicine, premature death rates in Windham have been increasing. And they've been increasing at an alarming rate. At 7,100 per 100,000 people suffer a premature death, which is almost double the state average. And those deaths in order of prevalence is cancers, heart disease, chronic lower lung, and intentional harm and overdoses are included in that. I then went back into the research and looked at how those were affected by incidence rates, and most of those had similar incidence rates. Had different incidence rates similar to their mortality rates, except for heart disease. Heart disease actually showed an increased mortality, but the same incident rates. So why are the patient population of this community more often dying from this disease than their counterparts? So I went into the exhaustive list of what causes cardiovascular disease, and by no means is this the whole list. And I got overwhelmed. So I decided to step back and kind of look at the community and see if I could get better answers and look at what they have to offer before I tackle a single mitigating factor. And I found out, interestingly, there's a lot of opportunities for physical and well-being health here. There's tons of public parks, community pools, sporting events, and with a community that describes 31% of them as being non-physical, I was surprised. So how do we look at a community that seems to have a bunch of resources, maybe not all of the resources on the medical side, but seems to have the potential for collaboration with Parks and Rec services, a large hospital base. Something I didn't mention was a big faith-based community. Like, how can we use those resources to combat cardiovascular disease? And here's some of the solutions I came up with. So we need to use these public spaces. There's so many of them. There are parks, there are public swimming pools, there are YMCA-based public areas. We need to implore the hospital to invest in education, which they already do. They have services that I didn't even have time to talk about that they offer at the hospital, but they need to do that in the community. And they do it in both English and Spanish, but that needs to be brought to the community. I think accessibility is a big deal here. There isn't any public transport. They need to promote policy change, maybe smoking deterrent taxes or complete bans of flavored tobacco products. Utilize that faith-based community to attract the Hispanic population, and then partner with higher education. There are universities throughout this community. I apologize, I'm rushing because I'm right at that 10 minutes, but I wanted to thank you so much for listening, and please, if you have any questions, feel free to email me.